In this element of dysfunction, we are going to be looking at drooling. Drooling can be observed in children from a young age, and also it develops when normal functional parameters are not met or have been interrupted. Can you see the pattern here? Varying degrees of severity, of course, and one thing that you must recognize when you are dealing with any kind of drooling patient, that sudden onset is a red flag, and that should be investigated further medically. So just be really careful that you look at the history of the drooling in conjunction with the drooling itself. But we need to also look at what the airways are doing. So why are they drooling? Why is their mouth open all the time to allow them to drool? Do they have problems breathing correctly? Also, too, sometimes occlusion will affect the way a person swallows. So you often find folks who are going through orthodontic treatment who have lost their normal occlusion will become droolers. And that's because their muscle function has been changed or challenged. Then we have to look at the neurological consideration. And then we have to look at medications, because medications in some circumstances can produce an overabundance of saliva. And if the normal parameters have not been met, then that could mean that the person is going to be drooling a lot more. One thing to remember about those muscle restrictions and the muscle dysfunctions is that sometimes if a person has a dysfunction in their TMJ that may come and go, that may cause them to drool. Now, drooling does not have to be right open, obvious drooling. Sometimes people will drool a little bit out of the corner of their mouth while they're speaking, that kind of thing. And then that is often due to a muscle dysfunction in their TMJ muscles. But drooling can be addressed in young children, and usually it's about getting that function corrected or getting it correct in the first place. Yes, it can be addressed and improved in older children and adults, and we often see that in our special needs patients. It can have then physical, psychological, and social impacts. So if you are working in the special needs population, look at the muscle function and see if there is a way to improve that. It may need that multidisciplinary approach, but oftentimes all it needs is getting the muscles coordinated and back up to speed. And that's where the Munchee is awesome in this situation. So remember, look at the why, plan where the Munchee use can be of assistance, and don't forget that the Munchee can be used to assist muscle function in children and adults and even those late lifers.